2020, which is when the first Mobilian was diagnosed with COVID-19. Since then, we have received reports of 45,734 COVID cases. 864 of those people have died. When we compare the numbers of COVID reported to us in the previous 7 days, we more than doubled the number of cases the prior week. And if we look at this just by the month, so if we, so far in July, and we still have about 6 days left in July, so far we've had 3,363 cases of COVID reported to us. I mean, that's more than the months of April, May, and June combined. So it's just extraordinary what we're seeing. And again, more than half of the cases are reported in 18 to 49-year-olds. And when we adjust for population, last week, the number of people aged 18 to 49 who were reported to have COVID was something like 300 per 100,000. My report today, our weekly expanded reports on 600 people between 8 and 49 have COVID-19 per 100,000 population. So really what we're seeing is that right now we have just a continuing explosion. Nationally, there have been some estimates that this may not peak until October. So cumulative number, as I just mentioned, 858 have died, 6,245 in the hospital or have been hospitalized. That's a cumulative number. And when we look at the number of daily hospital admissions, so these are the number of people who are in the hospital any given day. Yesterday, that number was at 143. So just 14 days ago, there were only 33 people in the hospital with COVID. And now 143 people are in the hospital with COVID-19. We've had, very high numbers of COVID reported to us, just alarming number of cases and hospitalizations coming in. We also are seeing a really stark increase in the percent of emergency department visits for COVID-like illness. It had been down in the low percentages. It's up now around 7% of all hospital emergency department visits being related to COVID-like illness. Then that big indicator that we look at, which is the percent positive. So in the statewide surveillance system last week, 21% of all COVID tests reported to the state health department were positive for COVID. 21%. That's the highest number we have seen throughout the entire pandemic. So if you think about that, it means that 1 in 5 people right now are infected with COVID. And if they are not at home and not masked and not distancing, they are spreading COVID to other people, 1 in 5. So think about that the next time you're at the grocery store or at a retail setting or at an event, whether it be indoor or outdoors, that right now in our county, 1 in 5 people tested has COVID-19. And if you're not vaccinated, if you get COVID, you have to stay at home for 10 days, regardless of whether you were wearing a mask or distancing. You also are putting yourself at great risk of hospitalization if you're unvaccinated and have any underlying health conditions or in those older age brackets. So something like, probably around 90% of hospitalizations are happening in unvaccinated people. It may be quite higher than that. We know that over 95% of people who die with COVID are unvaccinated. And the overwhelming majority of cases that we're seeing, something like 99.8%, are occurring in unvaccinated people. So the good news is there's still plenty of time and places to get vaccinated. So that is your best bet. And just want to sort of clarify a couple of maybe myths about COVID vaccine. But first, let me sort of talk about where you can get the vaccine. So there are, many providers, mostly pharmacies, where the vaccine is still available. At the Mobile County Health Department, at two permanent locations, Monday through Friday, you can get Pfizer or Moderna or Johnson & Johnson. If you get Johnson & Johnson, you could be fully protected within 2 weeks, right? Because you have to be vaccinated and wait 2 weeks before you have that, that designation of being a fully vaccinated person. For Moderna, it's 2 doses 4 weeks apart, and for Pfizer, it's 2 doses 3 weeks apart. So for those, it takes a little bit longer, 5 and 6 weeks before you can reach that level of being fully vaccinated. So Monday through Friday at 2 of our clinics, our downtown location and our location on Cox Street. And then we have 1, 2, 3, 4, 5 community-based events scheduled this week. So rather than going through them all, please go to our website at mchdcares.com, where you can learn, get the details about where we're going to be in the community. It looks like Burroughs Elementary, Mobile Regional Airport, Occupational Health Center, Church of the Good Shepherd, and Back to School Extravaganza on Saturday. We have a couple other locations or vaccine events, I think, that are closed vaccine events, but those are the ones that are going to be open to the public. And then again, get the details about our fixed location at on North Bayou and on Cox Street, Monday through Friday, 9 to 3:30. So we got a couple of questions from the media to answer. One is, how do you get more folks to get vaccinated? So, what the health department has been doing is trying to make vaccine as convenient as possible, right? We offer all 3 products. We have fixed locations Monday through Fridays. We have community-based organizations on the weekends. We go to truck stops, and we have had homebound missions, and we board vessels, and we go to churches, and we go to schools, just really trying to get it to the flea market, trying to get it in as many places as we can, so where it is convenient as possible. We did see almost a doubling of the number of people who got vaccinated last week compared to the week prior. And this, again, is just data that the vaccines that the health department is giving. So it looks like a severe rise in COVID cases is providing some motivation for people to get vaccinated. Maybe it's affecting them personally for the first time, and that has driven them to get vaccinated. I know I have close friends whose entire families have been diagnosed with COVID, and the mother is in the hospital, and they previously had elected not to get vaccinated, and now everyone in their family has tested positive, and the matriarch of that clan unfortunately is hospitalized, and so now they have gone out to make sure that they've gotten their COVID vaccine. Let's see. The reporter was also asking about the number of adverse events. So yes, it is true that adverse events related to the COVID vaccine are extraordinarily rare. People do experience mild reactions when they get their first or second dose of COVID vaccine, regardless of the product. But, serious adverse events are extremely rare. Just a few thousand reported out of, 3 or 4 million doses given. So it is a very safe and effective vaccine. The reporter was also asking about the jump in cases since July 4th. It is very easy to see that something changed on that 4th of July weekend. I think it's a combination of people being outdoors and not distancing, not wearing a mask since the mask mandate was lifted, the Delta variant becoming the dominant strain in Mobile County. It is much more highly infectious, and we have the worst vaccination rates in the country. So that trifecta likely led to the 4th of July holiday weekend becoming our sort of, Mobile County sort of taking a turn in the wrong direction. And we have seen since then just an explosion of COVID-19 infections in Mobile County. And then another question, wanting to know if Dr. Eishold, our health officer, would consider a mask mandate given the fact that numbers are going up. We don't need a mask mandate. We need people to get vaccinated. So last year when some mask mandates went out, or some, the state health officer and the governor issued mandates, they did that in a situation, in a time where we did not have a perfectly safe and effective vaccine. We have that now. So rather than having the health officer or our governor order us to do the right thing, we really have to rely on everyone to do their part to take a very safe and effective vaccine to try to turn this around. So no, it is unlikely that any mask mandates will be coming from either the health officer or the governor. So the things that you need to do are get vaccinated. Remember that getting COVID does not create a situation where you should not get vaccinated. If you have had COVID, you should still get vaccinated. We hear all kinds of stories where people are told by their doctors, oh, you already had one dose and now you have COVID, you don't need to get vaccinated again. That is not true. Having a COVID infection is not the same as getting a full vaccination series. Getting COVID does not replace a second shot of Pfizer or Moderna. We don't know how long natural immunity may last. You can't lift quarantine if you had COVID last year. And the crazy thing is that people could get COVID 2 or 3 or 4 times depending on how many variants we see sort of storm through. So no, when you get COVID, you have a 90-day window where you don't have to quarantine, you should not get tested, and you may be you're unlikely to get COVID again in that 90 days. But after that 90-day period, all bets are off, and the only thing that can protect you or create a situation where you can be exempt from quarantine is if you are fully vaccinated. Mark, do you have a question about that? 2 questions. Okay. Yeah, go ahead.
Sorry, one popped in.
It's okay.
So what is Mobile going to do with the rise in cases, going to do with school starting? Will our child be wearing masks?
So it depends on the individual. Sorry, let me repeat the question in case you didn't hear that. So the question is, cases are high, schools are starting back. What is going to be required of children going back to school? So each school system will make their own decisions about whether schools will be required, whether students and staff will be required to wear masks indoors. The very strong recommendation from the Centers for Disease Control and the Mobile County Health Department is that any person who is unvaccinated should wear a mask in an indoor setting in K through 12 schools. Unvaccinated people should wear a mask in any indoor setting, particularly indoors at K through 12 schools. But again, it is up to each individual school system to determine what they are going to require. Okay, question number 2.
Can you talk about treatment options instead of vaccinations or other mandates?
We can talk about treatment options. I'd rather do that tomorrow, Mark, so that I can make sure I have it with me. But again, it's really interesting to me that, when I talk to someone about, taking a safe and effective vaccine, they're like, I'm fine, I'm healthy. And then when they get COVID, they want to talk to me about remdesivir and monoclonal antibody treatment and ivermectin and ivermectin and all of these other treatments, right? Then they're scrambling to try to figure out where if we had just, taken a safe and effective vaccine, we likely would not have to worry about understanding all the complexities around, FDA emergency use authorized treatment for COVID. So saying that the vaccine is not approved is a losing argument if then you're also seeking not FDA approved, but FDA authorized treatments after you get COVID. So please get vaccinated, and we can talk about the treatments tomorrow. Okay, yeah, I just want to have my, they're hard enough pronounced when you've got them right here in front of you, so I just want to make sure I get it right. So I just want to talk about a couple of myths about COVID-19 vaccines. So, like, I get it, right? It's hard to sort of determine like what source of information you should trust, which information you should be suspicious of. Everybody uses Google to do their research these days, but of course it always matters what website you land on. So try to find a trusted expert, a trusted healthcare provider, a doctor, a nurse, a pharmacist, a dentist, an optometrist that you can talk to help think through some of these things if you're still on the fence about getting a vaccine. So I'm just going to go through a couple of these myths. Can receiving a COVID vaccine cause you to be magnetic? So the answer is no. Receiving a COVID vaccine will not make you magnetic, including at the injection site, which is usually in your arm. It's in the upper deltoid. The vaccines don't contain ingredients that can produce an electromagnetic field at the site of your injection. All of the vaccines are free from metals. So here's another one. Let's see. Do any of the vaccines authorized for use in the U.S. shed or release any of their components? And that answer is also no. Vaccine shedding is the term that we use to describe the release or discharge of any of the vaccine components in or outside the body. It can only occur when a vaccine contains a weakened version of the virus. None of the vaccines currently authorized for use contain live virus, nor do they contain weakened versions of the virus. Okay? So right now, mRNA and viral vector vaccines are the two that we currently use, and they do not contain live virus or a weakened version of the virus. Okay, here's another one. I get this one all the time, particularly from nurses who are not getting vaccinated. Is it safe for me to get a COVID vaccine if I would like to have a baby one day? Lots of people thinking about rumors out there about infertility. So yes, you can still get the vaccine if you want to have a baby one day, whether you're a man or a woman. So if you're trying to become pregnant now or want to get pregnant in the future, you can get a vaccine when it's available to you. There's no evidence that COVID-19 vaccine causes any problems with pregnancy, including the development of the placenta. Right? There were some rumors about that getting vaccinated might do some harm to the placenta, but that is not true. In addition, there is no evidence that female or male fertility problems are a side effect of any vaccine, including COVID-19 vaccines. There are a couple others, and maybe we'll talk more about these later, but will taking a COVID vaccine alter my DNA? No. Will it cause me to test positive for COVID? No. So just some things that I wanted to share with you. So we will talk some more about those tomorrow. Okay, one last thing, unless there are any more COVID questions, Mark. Okay, I'm getting the sign. Okay, so before we move on, I just want to remind everyone that Mark sent out a news release earlier today that the first case of human West Nile virus, which is a mosquito-borne encephalitis, it can cause fever or a more severe encephalitis, has been confirmed in Mobile County, and this is the first one reported this year. I don't think we had any last year, but it's just a reminder that it is hot and wet and humid out there, and please do your part around your house to reduce mosquito habitat. Tip and toss to get rid of standing water, and wear mosquito repellent when you're outside, and make sure your windows have screens on them, because we have detected at least the first case of human West Nile virus in a Mobile County resident. So please protect yourself from mosquito-borne infections. Take a read of that news release, or let us know on Facebook if you have other questions about ways to protect yourself. All right, so I think that's it for today. We are going to give brief Facebook updates every day this week, and take your questions and try to answer them to the best of our ability You guys know that we just try to be factual and provide information to you. So please let us know what kind of rumors or misinformation you're hearing out there, so we can try to get that corrected, so that we can get compel as many people as we can to get vaccinated and really help us move out of last place with regard to the percent of our population vaccinated for COVID. Right now, we're still standing around 1 in every 3 people vaccinated. So please, if you have been thinking about it and you're not sure, reach out to me, reach out to someone that you trust, and talk about it. And let's see if we can't get the vaccination rates up for Mobile County. So have a great week, everyone, and we will talk to you tomorrow.